Hey guys, we are finishing up our functional medicine case with Jemma, and we're on the last video, and this is where we're going to wrap things up. So if you're just joining us now, you're definitely going to want to start at the beginning because we really lay out the case, all the prior health history issues, her past medical history, her autoimmune disease, and you're not going to really follow unless you watch from the beginning. So, okay. So this is her lab work again, and we last left off with a shift in the way her immune system is functioning. She is very much what's called Th2 polarized. Now, we see an elevated eosinophil count like we talked about. This should really be 3, and as a matter of fact, I think some more recent literature says even that might be high. Not high, but just indicate an issue, and as a matter of fact, we might even start thinking that 2 is the new normal. And not just 3, but she's certainly 10 times higher than the normal. So let's look at her last bit of labs here. She normally runs, hold on. Where is it? Calcium, vitamin D. You know what? That quest didn't show her past CBC. Anyway, this is called a CBC, by the way. This blood count with differential on her traditionally was pretty normal, 60-30, 6-3-0. So this is definitely a departure from the normative her state. So we call this a shift Th2 polarization, and we see that in diseases of atopy. Allergies, asthma, eczema, hives, and she kind of has a history of that. So she had that pneumonitis issue we talked about earlier, and also we talked about parasites. Now, she did travel to Central America, so this could really be where the case is in fact heading. So I wanted to draw your attention to a couple pieces of research here. Let me see if I can pull that up. Okay. I don't know if you can see this. Eradication of Blastocystis hominis. This is from the Journal of Infectious Diseases. Eradication of Blastocystis hominis prevents the development of symptomatic Hashimoto's thyroiditis, a case report. This is just an interesting case report where they take a 49-year-old man who had chronic urticaria. Again, that's a disease of atopy, hives. During examination, Hashimoto's thyroiditis was found even though the patient never had clear symptoms of the disease. Blastocystis hominis, which is a parasite, was isolated through the stool and implicating that this parasite can cause a development of Hashimoto's thyroiditis and chronic urticaria. After 2 weeks treatment with a medication that kills blastocystis, it was eradicated. Then the urticaria and angioedema, which is swelling around the eye, is a deep-seated allergic reaction. During the 4 years follow-up, the patient presented without any symptoms, whereas thyroid hormone was normalized and antithyroid antibodies were declining. For the first time in the literature, we show that eradication of Blastocystis hominis can prevent the development of both symptomatic Hashimoto's and chronic urticaria. This was published in 2015. So we're seeing more and more in the literature that parasites can be a trigger for autoimmune disease, and in this case, Hashimoto's disease. All right, let's look at another. You can Google this, and there's a lot of other articles too. Okay, this is another article that says immunological changes of T helper cells and flow cytometry stored CD4 positive T cells from patients with Hashimoto's thyroiditis. And what they're saying is that, let me see if I can find it. So they looked at 389 patients with Hashimoto's thyroiditis who had antibodies that were high, hers are, and thyroid function was measured. The findings demonstrated that the portion of peripheral Th1 cells was significantly lower in patients with Hashimoto's than in healthy euthyroid controls. And the proportion of peripheral Th2 Treg cells was significantly higher in patients with Hashimoto's than in euthyroid normal cells. So what this is saying, in patients with Hashimoto's, oftentimes we do see that chronic Th2 polarization, and a way to kind of stumble upon that in lab work is looking at the differential. If you see the eosinophil count even a little bit high, 3, 4, 5, 6, 7, you have to start thinking, is there a Th2 polarization? What's interesting about a Th2 polarization, this is one of the reasons why certain autoimmune diseases make you more prone to getting some of the cytokine storms. This can lead to an elevation of a cytokine called Th17, and this can be implicated in some of the COVID-19 severe side effects called the cytokine storm. So this person may be an at-risk person if they have a chronically Th2 elevated cytokine profile. So that's very, very interesting. Now, so she's kind of had her steady state, and then she went to Costa Rica. She likely has a parasite. We're going to run the test on her, which could account for things stirring the pot autoimmunity-wise. So it could be the reason why her glucose is a little bit up when it normally isn't. Or could that be an expansion of maybe some autoimmunity? Certainly is aggravating, or could be aggravating, the hypothyroidism where it was normally under good control. So this is an interesting, and versus if you go to see your regular GP, they're just going to give you more medication. Well, as we saw in the other study, why not kill the underlying parasite so you need less medication, if at all? So anyway, I think this was a good case study. So we're going to do more of these in the days to come. And if you have any questions, feel free to contact my office. You can reach us at functionalmedicinenorthernvirginia.com. And I'm happy to do a phone consultation. We even do Skype calls and things like that in telemedicine. Okay. All right. Signing off.